Friends, I am Dr. C.J. Keshwamurthy from Shumaga, Geriatrician. Dear friends, welcome to my Geriatric Medicine channel. In this episode, I am going to talk about the fatigue and weakness in the elderly people. What is the difference between fatigue and weakness? Fatigue is characterized by feeling of extreme exhaustion, not preceded by extraordinary physical activity. Difficulty in concentrating on physical and mental functions, and generalized inability to accomplish necessary daily activities. So, friends, weakness usually is accompanied by decreased muscle strength, reduced endurance in repetitive muscle activity like exercise, and often associated with physical abnormalities and of the neuromuscular system. So, friends, what the main reason for fatigue? Whether it is mainly due to physical or psychological reasons. Multiple factors are responsible for fatigue and old age. Sum of life events such as death, spouse illness, and concern about the finance may lead to feeling of fatigue. Further, the mere self-awareness of growing old may cause symptoms of fatigue in the elderly. Poor nutrition, lack of physical exercise also may lead to these symptoms. Fatigue is commonly associated with depression. Friends, also chronic infections, diabetes, neurological diseases, heart diseases, and anemia have been linked to fatigue. We know that many of the micronutrients, proteins, and B complex factors, iron, hemoglobin, when they are deficient, may also cause physical fatigue. Friends, what I would like to stress upon is fatigue occurs in the elderly person when he is suffering mentally because of so many factors within the family, apart from the deficiencies of protein, vitamins, iron, etc., which I have enumerated earlier. The tussle between the family members will cause a lot of depression and fatigue in elderly. They are unable to move about, perform their activities of daily life because of these factors. And physically, when they suffer from a lot of pain in various parts of the body, they will feel the fatigue, though the definition won't describe all these things, involve all these things. The pain factor is the root cause of the fatigue in many times. When the pain is removed by means of analgesics or antibiotics or recreation, the patient feels energetic. His fatigue disappears partly. Now let us move on to another aspect which is called loss of weight. Many of the elders, say after 60 or 70 years, lose their body weight because of so many things. We will have to consider Whether the loss of weight is normal when one grows older. How to know the abnormal loss of weight is dangerous to the person. Even a healthy person tends to lose weight with advancing age. But if the loss of weight is more often more than 4 to 5% in 1 year period from the recommend, it becomes abnormal. There are many causes which for the loss of weight: poverty, lack of proper diet, infections like tuberculosis, HIV, and other virus diseases, cancer, and cardiopulmonary disorders like heart failure, asthma, what we call COPD, chronic obstructive pulmonary diseases, the kidney failure, depression, hyperthyroidism, diabetes mellitus, dental problems in which a loss of teeth, dentition takes place, and the drugs which we use for all the diseases, antibiotics, digoxin for heart failure, and so many things, so many things. All these factors causes uh, loss of weight, loss of appetite, and so poor food intake, it will cause loss of weight. Socially, when the elderly person loses his spouse and friends of his age group, friends of his age group, spouse is okay, he has to live alone. Loneliness causes a lot of depression in him, loses interest in all the activities of daily life, even taking bath, even grooming and walking, etc. He will lose interest in all them. Even which he used to worship God earlier, now he loses interest in worship God also. So loneliness is one of the major factor in the disease of losing weight. There is one more aspect called Frailty Syndrome. When everything is normal in his daily activities, social contact, social the family members, etc., the patient tends to lose weight, and that is called Frailty Syndrome. Frailty Syndrome, which I am going to discuss later. Friends, if you like the material in this channel useful for you and your family, your friends, then go to the channel fully, like it, subscribe it, and share it with your friends. Again, I stress upon one point: subscription. Subscribing the channel is different, subscription is different. We are not asking for subscription. The number of subscriptions will encourage me to give you more and more important subjects to share with you, and so subscribe it my channel. It is totally free of cost. So friends, thank you very much for going through this channel. Jai India, Jai Karnataka.